Hi everyone, I am Dr. Diane Hayden, publisher of Natural Nutmeg Magazine and Essential Naples Magazine, and I'm excited today to have for our Path to Healing three experts on today. I'm going to go ahead and introduce them. We'll be talking about gut health and digestive disorders today. So I have Dr. Katie Fearson. She is a naturopathic doctor in Southport, Connecticut. A Connecticut native, she's the owner of Coastal Natural Medicine with over 25 years of experience in healthcare. With individualized treatment, she builds lasting relationships with her patients to help them along their healing journey. Dr. Fearson specializes in gut healing and chronic conditions using a breadth of treatments to stimulate vitality and facilitate healing. She's earned her certification in vitalism and has served as the Director of Education and on the Board of Directors of the Naturopathic Medicine Institute. And she is currently the host of the radio show Healthy by Nature on WPKN 89.5 FM and is passionate about educating the public about naturopathic medicine. So welcome, Dr. Katie. I have Gigi
Thank you.
Aducci. She is a certified colon hydrotherapist, integrative health coach, and patient navigator with deep expertise in gut microbiome healing, intestinal tissue repair, and holistic pain management. She blends clinical insight with natural modalities, bridging the gap between conventional medicine and whole body wellness. Her mission is to make holistic care mainstream by combining evidence based protocols with intuitive, gut first healing strategies. We all know everything starts in the gut, and true wellness means integrating the best of all worlds by combining modalities to address each underlying root cause. So great to have you here, Gigi. And Dr. Lindsay Maher is a naturopathic doctor and licensed acupuncturist with a strong focus on gastrointestinal health. She helps patients uncover and address the root causes of digestive concerns using a blend of functional lab testing, naturopathic therapies, and acupuncture. As the founder of Soleil Acupuncture and Naturopathic Wellness in Hamden, Connecticut, Dr. Maher also supports hormone balance, fertility, and women's health, recognizing the deep connection between the gut, hormones, and overall well-being. She holds certifications in weight management, facial acupuncture, RF microneedling, and Aquafirm XS, and has advanced training in menopausal hormone therapy. And she's currently pursuing fellowship in naturopathic endocrinology and board certification in oriental reproductive medicine. So welcome, Dr. Lindsay. How is everybody today?
Very good. Thanks for
Awesome.
having us.
Yeah, awesome. So, Gigi, I love what you said. We all know everything starts in the gut. And I think that that is true. I think more people are now starting to realize the importance of that and how critical it is as well. But I wanted to kind of start out with all of your different opinions on why do you think we're seeing so much gut health and digestive disorders nowadays? Like, what do you think is going on with people's diets or environment or, anything that you guys are seeing in your practice as to why there's such a predominance of that now?
Well, we're overloaded with toxins, fake food. We're not eating what our ancestors ate 100 years ago. There was a big difference in farming and our food supply, and morality has changed, and what allows to go through and on people's tables in our stores, what we have access to has changed. So between politics and bad guys and bad policies, um, I think it's all of it, all of the
Yep,
above. I think we're just being poisoned in every which way.
yep,
Even our water can affect gut biome. And our inflammation can go up, not just because of what we're eating, but what we're breathing, what we're drinking. Lack of sleep, stress affects our gut. So there's a whole bunch of stuff. There's our lives changed. We have moms that used to stay home and take care of the kids, and there was dad, and money was okay. There wasn't such inflation. There was a good ratio between income um and bills, right? Your bills. And now everyone's got to work. You got to put your kids to work. You got
practically,
to have
yes.
kids just to have more money in the household. That's kind of where we're at. So it's a little bit of everything. And I just think we have to just go back to basics, eat as normal and whole foods as possible. I mean, there's a lot to it. I do have a slide presentation that I would like to share, but you can just let me know when I can do that.
If we have time for that, sure, sure. We're here mostly just to be a panel of experts asking, questions and answering them. So, Dr. Katie, what are you finding in your practice?
I agree with Gigi. It really, you could do it a whole hour long or multi-hour presentation on just that, all of the things that we know affect the gut. The question really was sort of why now do we see that there's more happening? And I think there's a lot of things currently at play, even in just the last couple of years that have shifted. I think, post COVID, there's a collective effect of stress that occurred to people during that time that really affected the microbiome and the cortisol levels and how they affect the gut. So cortisol reduces enzyme production in the gut by about 22 times, reduces blood flow to the gut by about 4 times. So just stress alone and then major stressors like that have a huge role. And I personally don't feel that people's health has truly recovered. I think we all went back to sort of normal routine, but didn't ever stop and sort of allow ourselves to heal from that time. And it affected all of us differently. So what I see in my practice currently is that stress levels and cortisol levels are not just elevated from day to day, they're significantly elevated. And I think lifestyles are not allowing us to, eat properly. I think, eating at regular times throughout the day is important. So we're just sort of really scattered, I think, energetically and lifestyle wise. And I think right now that seems to be at a peak. That's what I'm seeing in practice. I mean, patients they just are maxed out. They just can't do it anymore. So our ability to compensate is completely compromised.
Mm-hmm.
So.
Yeah, no, I agree. I agree. Dr. Lindsay, how about you?
I would say it's definitely a culmination of both of those things that Gigi and Dr. Katie have mentioned. I like to think from a toxic standpoint is also and tying in with this post-COVID world that we're living in is that the sense of community has really died down for people. And, coming from a place of where you're told to just be in like a little cohort or a little bubble of people. And now then, going out and I mean, as much as people were yearning for human interaction, we also, I think some people still kind of like to stick to themselves, but humans are meant to be a part of a society and a community. And without that, that plays a role largely on stress levels too, and who it is you're surrounding yourself with. If you're surrounding yourself with toxic individuals, that's just as toxic as consuming toxic food or ingesting other toxic materials. Those are a big piece of it. And I do largely see that in my practice as well. Most people are just not digesting their food, and it's just a large source of inflammatory burden that's then spilling over into all of the other aspects of one's health. And we see, especially the rise of autoimmune diseases, and there's definitely links to gut health and autoimmune disease. And that's one of the connections that I primarily see.
Can I add one more thing?
Mm-hmm.
Just because I have a visual, because I do colonics. And what we see in the tube, you wouldn't believe what we see in the tube. So when they're doing the program, the 15 and 30, and then we get to colonic about 11, 12, 10, we start seeing like chia seeds, or we're seeing Metamucil come out of there, where I'm assuming it's Metamucil because it's white and goo, the way it looks as it goes in the cup, it's coming out. So we see this insoluble fiber. So I think what we are known, we tell people eat more fiber, do this, add fiber to your diet when you're constipated. I think that's the absolute wrong thing to do. At least that's proof and evidence of what I see in the tube. It's actually creating, I call them traffic jams, and we just have to break through the traffic jams. That's why colonics is the only thing that will open, expand the colon, and be able to like flush stuff out. So you're just hitting and you're unblocking the traffic jams, and you're just peeling at it. The water hits it, and it's just water. I don't put anything in there. I think only water is decent and enough. Otherwise, we might have an interaction with some herbs or anything. And I do know naturopaths that do colonics, and they do use herbs. I don't think it's necessary. I don't, even if I became a naturopath, I don't think I would do that. Um, and I don't think it's necessary. I think the safest route is just hit it. It's about the pressure and the water, and I call it marinating. And I'm going to kill a lot of food words for you guys. We marinate for a few days and soften all the stuff in there, and then everything comes out. And series of colonics are important to get up the colon and really get rid of those traffic jams. Because, and then I've seen crackers, I've seen graham crackers bunched up into little balls. And then I go, that's an odd color. I'll tell the client, I go, what is that? And she goes, I go, do you eat graham crackers? And she goes, yes. How do you know? And she goes, I eat tons of it. And there you go. It's creating impactions. I've seen impactions of Oreos. I've seen, so it's I don't want to say impactions, actually reverse traffic jams. I don't want to say any medical words, but it's that's what we're seeing. We're seeing the oddest things in these tubes, and it's supposed to be food, and sometimes the doctor puts them on their GI, or even a natural a doctor can give them things, and everyone swears by fiber, and I see that it's actually creating more issues than helping. And there's a product, Senna, that I've seen a lot of big problems with as well. And we see like this damp, shiny, heavy sludge poop that stays low in the colon, and we can actually get that out last, and all this other stuff is going to come in, all this newer stuff. And how I know, it's by the color. So we know, and I can actually feel it when they're filled in with water. So there's all sorts of bad information, or not enough communications between providers to say, hey, listen, this is what I'm finding over here, and this is not working, and maybe we need to investigate this further and talk to other colon hydrotherapists, and let's put a real protocol together, and stop like giving bad advice, and just be able to collaborate and talk to the person who sees it, firsthand. I think that's very important.
Yeah, for sure, for sure.
Can I just kind
go
of
ahead.
expand on the fiber thing
Yeah,
for a
go ahead,
second?
for sure.
So just in general, I think it's important to make sure we're like that we explain that there are nuances to fiber. I think if we just say increase your fiber in the diet, that's not always helpful. There are prebiotic fibers that are necessary to help the microbiome. There's soluble, insoluble fiber. There's, grain forms of fiber, vegetable forms of fiber. There's supplements versus what we actually get from our food. So I think to say fiber in general is bad. I think we just have to be careful about like an umbrella generalization, but I agree with Gigi that it's important to, consult people that can help figure out the nuances, and that, if you just Google something and it says add more fiber, you definitely can do harm and not help. So I think I agree with Gigi that sort of having that clarity about what each individual person needs is really important.
I let people know just to stick with fruits, vegetables, and whole food diet, and kind of stay away from the powders. We've even seen issues with the mushroom powder in there, and that's like a whole different thing. I've seen like dry, the water just doesn't even come out. People are just absorbing the water with these mushroom coffee, mushroom powders. I mean, it's like the new rave. It's like this new way of the way they're dehydrating, the way they're separating these things. It's just not working. People are not wet enough. They're not hydrated enough to be able to pass these things. They're just like turning into little balls and sucking, and you can see it. They can feel it, and we can see it, what's going on when they're doing a colonic.
So I wanted to ask another question about where disease usually starts, because we kind of started with, and this was in your bio, Gigi, about all disease, everything starts in the gut. So we also hear that everything starts orally in the mouth. So if you guys could just speak to that, like what is there, do you believe that it's gut first, mouth first, the other way around? Like what's really happening when we ingest certain foods, or, bad things versus good things? What's your philosophy on where it actually starts?
Lindsay, do you want to start, since I feel like we've been doing more talking?
I think it overall, there's a biochemical individuality that comes with from person to person. And I'm not big on generalizations. And I think in a naturopathic realm, sometimes there can be myopic pieces, but I think overall, naturopathic medicine comes from a place of identifying and understanding that people are individuals and there's no protocols that you can speak to like across the board. There might be some similarities in what you do from person to person, but overall, there's going to be nuance to it. And I think it's mostly coming from environment and surroundings. If you just don't know something, you don't know it, right? If you grow up in a household where cereal is a mainstay for breakfast, you understand and identify that cereal is breakfast. Whereas if you come from a home where eggs and a savory breakfast is breakfast, you know that. And I don't think that there's anything wrong with either of those circumstances if a person comes into the office stating that. But I think it's mostly just understanding that a lot of that is shaping behavior. And that is what is shaping what then goes in your mouth, what activities you do or don't do, and then the types of relationships that you form with others.
I like it.
I agree with Dr. Mar. I always say your last name wrong. Is it Mar?
It's Mar. You can call me
Mar.
Lindsay.
Okay. Um, I don't think you can say it starts in the mouth or the gut as a separate entity. So the mouth and the gut are both part of the digestive tract anatomically. So there's a continuum from your mouth all the way to the anus. And so I would say something that's affecting the mouth is also going to affect the gut potentially and vice versa. But as far as the disease starting there, the mouth and the gut don't go awry on their own. So the body is an intelligent organism that any symptoms we have or disease we have is the body's adaptation to a circumstance that it's trying to survive. So if there's an adaptation or a symptom in the mouth or the gastrointestinal tract, those things don't just spontaneously combust. There's a cause there. So when we say what's the cause of disease, and people might say, well, disease starts in the mouth. It's what Dr. Marr is saying is that the mouth itself doesn't just start to have a problem. It's based on behaviors and nutrition. And so the cause of the disease is going to be whatever is impacting the body in that way. So if it is poor oral hygiene, of course, is going to affect the health and disease. But it's whatever's influencing oral health and whatever's influencing the gut that's actually causing the disease. And that's different for every person.
Yeah.
Well, I think there's evidence that you're born with certain microbiomes or even microplastics. So they're finding that the children that they're born with in the placenta or in their umbilical cords, they already have all this stuff going on, or they don't have enough microbiome. So they're testing the bacteria in them, what they're born with, or even their stool. So there's kids that are born with very little, and I can't pronounce these things, lactobacillus, and you're the doctors, please. The one that controls if you have a high dose of this bacteria in the gut, that is the big responsibility of how strong your immune system is. And these kids are being born less and less of this good bacteria in their gut. So, and that's like a new phenomenon that's just been going on for probably like, I believe they just noticed this like 5 years ago. So this is absolutely a brand new phenomenon that they're testing stool, and the mom has less and their children have even less. So they're already born with a lower immune system. And then of course, everything else, the other two doctors stated, it's all of that, but there's something very, very wrong, and it's happening at birth.
Yeah,
Sorry, go ahead, Lindsay.
I think that also just speaks to what Dr. Pearson and I had mentioned regarding like surroundings and influences. They are testing so I do some functional stool analysis, and I'm also familiar with a company that does fecal microbiota transplants orally. And basically, both of their criteria for accepted donors or metrics of success, or like a scale of ideal functioning or microbes or et cetera, within the gut, are based off of, this is a few of the circumstances, but it's never having had antibiotics, never having had anything besides whole foods, were born vaginally, and were breastfed. If you don't even meet those basic criteria, you are not considered a healthy control. And we know that the rates of C-section have increased in the last even 5-10 years. We know that actually, I mean, it looks like breastfeeding is making a comeback as if it were a
Fad.
yeah, exactly. As if it were a fad.
Yeah.
We know that more women are breastfeeding now than they were potentially, even like in my generation. But, those things all tie in. And I can speak from a personal place where I was a C-section and I was formula fed. I grew up largely atopic, loads of allergies, sinus infections, galore. And working on my gut health specifically, and then identifying with other patients who have felt similarly, have really optimized my overall health. But that is what we are seeing across the board, is that if you don't meet those basic 4 criteria at the minimum, you are probably at some degree of quote unquote unhealthy. And those are all shaped by our surroundings, behavior, lifestyle, etc.
Which two are beyond our control: how you were born, whether or not you were breastfed, right?
Exactly.
Individually, they're beyond our control, but I do think they're, so maybe I'm just showing my age, but it's not new information that we know that the baby gets their initial microbiome from the mother when they go through the vaginal canal, and then also through mouth contact with the skin and skin to skin contact. So we all have a microbiome on our skin. When the baby latches onto a nipple, that's where they get probiotics as well. We've known that for a while, but I think people, I actually think this is the kind of thing where social media is helpful, because I think there are things that have been known for a while that are now more generally and widely known because people are accessing that information on social media, which I think is one of the benefits. And there was a while where C-sections really were sort of for convenience, like people were like, oh, well, I just want to I want my baby born on this day because it was my grandfather's birthday, or the doctor was going on vacation, so they wanted to make sure they delivered with that doctor, so they would schedule a C-section. And I think we are moving away from that, at least, which I'm happy to see. So definitely more encouragement of vaginal delivery for sure is helpful.
I'm glad this came up actually, because that kind of prompts a question for me that I would not have thought of. So I'm going to use myself as an example. So I was a C-section baby. I was not breastfed. I'm sure I've been on antibiotics. So what would you say? Like, let's say I'm not necessarily having any gut issues that I know of, right? Like I don't have any symptoms. What would you recommend for someone in a case like this, where like some of these things have been kind of beyond their control, but what can they do now to maybe be proactive about having any gut issues down the road? I mean, obviously the first thing is the whole food diet, right? So let's say the person eats relatively healthy. What else would you guys recommend to do?
Well, I would say that everything is a gut issue. So you don't have to have a gastrointestinal symptom like a bowel change to have a gut issue. You could have regular bowel movements, but have skin issues or anxiety or fatigue or, weight gain or hormone issues, and not have an overt gastrointestinal symptom. And so those are all gut issues. So I think anything that you're experiencing can be tied back to the gut. So I would recommend doing a gut healing regimen, and there are different approaches to that. I'm sure all 3 of us have a slightly different approach to that. But I would heal the gut. I mean, I would just go through that process, even if you don't have a lot of symptoms. I would, so again, we're looking at microbiome, foods, food intolerances, of all of the aspects and foundations of health that influence the gut. one of the things there's a lot more research about now that we know affects the microbiome is sleep. And sleep is largely affected by electronic devices now. So there's a lot of different lifestyle aspects that go into what I would look at with a patient in terms of healing their gut.
Mm-hmm.
Yeah, and I think it's also something that I would look to address too is if there are, aside from even food intolerances, even food aversions, right? Like these things give us pieces of information of things that are probably happening in the inner workings, and also cravings. Because if we are craving certain things, that is largely the bugs telling you what to eat as much as you are responsible for feeding them. And they're living organisms as much as you're a living organism. And so if you find that either maybe your palate has changed for whatever reason, if you have noticed that you're just not interested in certain foods that you used to love before, like all of those can be key indicators that something can be going on inside of the gut as well. And that's why it's really important to take inventory of yourself and know what your baselines and your normal are, because normal is different across the board, and variation is really where the obviously the differences are going to be for everybody.
Mm-hmm.
So
Yeah,
my
that's
mom is from Europe, and I'm sure she had a vaginal birth, and I'm sure she was eating organic. She grew up on a farm, like the best of us. She did smoke with me while she, was breastfeeding at the same time. So that she did too. But I had constipation from beginning, from I was born, like severe impacted constipation, painful. I suffered with it. I was terrified of food the first half of my life. If I had a plan to eat ice cream or dairy or corn or popcorn, or it was like a big thing the first half of my life. I ended up having ulcerative colitis, diagnosed with ulcerative colitis in 2004. And then it turned into Crohn's, and it went into my pancreas and my liver. And I was a hot mess. I was a big inflammatory hot mess. And they wanted my colon in 2006. I was doing a colonoscopy about every 2 to 3 months apart. I was very severe. I'm going to share it with all of you. I was in a diaper for 2.5 years, eating baby food for about 6 months towards that end of that time. And my wake up call was when the doctor says, we don't know what's killing you. It's either your medication, which I was on these steroids, or your disease. And I go, well, that's so simple. You said I'm going to live with this disease for the rest of my life, so let me get off the drugs. He kicked me out of practice for doing that. So 4 GIs had to kick me out of practice because I wanted to experiment and see what was hurting me. Needless to say, yes, we all have a different approach. Also, needless to say, I did do it holistically and ended up getting off medications. I did save my colon. But like I said, we're born with it. My mom grew up on a farm. There's so many things, environmental factors for sure, but something is going on even before you even have a chance to screw yourself up. That's why you have little kids with Crohn's disease. You have 2-year-olds, you have 1-year-olds that are suffering. There's something bigger going on, that's for sure.
Yeah, definitely. Before I forget, I want to ask the 3 of you to put your contact info in the chat. So any information that you want the listeners to have, your phone, email, web, anything like that, however you want to direct them to be able to reach out to you guys after. So when you get a minute, just pop that in the chat. So one of the things that I think really got me, more focused on being aware of how important gut health is and what can happen, down the line if you don't take care of this, is when I started reading articles about the connection between gut health and cognitive function. Like that potentially gut health might now lead to things like dementia or Alzheimer's or, brain health issues. So what are you guys seeing with that? Are you seeing any of that? And what do you recommend to your patients, your clients, and how do you educate them about like how important this, gut health is and what it can lead to in terms of issues with cognitive function?
I think it's largely interrelated. We know that roughly 90% of serotonin, your happy hormone, is made in your gut if you have the organisms and the physiological functioning to do that. And then there's the matter of having it get to your brain. And you need the ability, lack of inflammation to do those things. And so there's this concept that of leaky gut, and we don't really have to get into all the details. It's kind of been something that has become more popularized as of late. But if there's a leaky gut, there's likely going to be a leaky brain. And so that means that there's things just not getting there, or the things that are getting there are not staying there. And so you could be, whether that's you're making the serotonin but not able to get it there, or you're just not making it because you don't have the microorganisms to do so. I have a lot of stool tests that I've done, and so many of them come back that these individuals don't have the organisms to make GABA, which is an inhibitory hormone and calming. And a lot of them do have a bit of anxiety, trouble sleeping, potential other mood disorders, and it's largely interrelated. And then kind of back to what Dr. Pearson said, is sleep is so crucial, not just to you as in a regenerative sense physically, but also for your organisms, because they're taking the cues from everything that's happening outside of itself, from what you're doing or not doing. And that's largely controlling the environment that's internal.
I agree with Dr. Marr, and I would say that the gut-brain connection is reciprocal. So I think, again, looking at how our response to our environment from a brain chemistry standpoint, looking how that then triggers the production of cortisol and neurotransmitters, and how those inflammatory things affect the gut as well, and then how the gut then feeds back to the brain. So it's a feedback loop on both sides. There's also a connection between the brain and the gut via the vagus nerve. So the vagus nerve is the only cranial nerve that exits the skull and passes down, and it innervates the gastrointestinal organs. And it's also something that is part of our stress response. So we have this nervous system response connected by the direct innervation of the gut from a cranial nerve. So there's literally a physical connection between the brain and the gut that's very unique and has a big impact. So the other piece to that is the serotonin levels. The serotonin, the majority of it's produced in the gut. So if there is inflammation or leaky gut, it's going to affect, your feel-good chemicals. It's going to affect your body's ability to actually regulate its mood and how you feel. So there's so many connections, but we do really have a pretty good awareness of how they all sort of feed back into one another. Again, inflammation in the gut is going to affect absorption of nutrients, and then that's going to affect the microbiome and the brain health. And so, you could just go on with the connections there.
I got to share something with you guys. Let me share my screen. It's an amazing story of a client. She had a stroke, not verbal or anything like that. Now, everyone reports after the colonic, they get rid of these weird looking things that I want to really show you what they look like. And all of a sudden they have clear vision, their head's clearer, they're sleeping better. It's not just poop that's coming out of people's bodies when you're doing a colonic. But my most amazing case is this one I'm going to share with you. She had a stroke. So I'm going to share my screen. And some stuff of her came out. And it's this thing right here. Can you all see it?
Yep.
Yes.
Okay, so this is just a little piece that came out. This is not hers. This is someone recent that I took a picture of just for this presentation. So when something like this, we don't know what it's who knows? I always tell them I don't know what it is. We're not taking it out of the tube. We're not testing it. Whatever it is, whether it's it could be just the biofilm in the colon. It could just be whatever it is. Whatever it is. I'm not going to say what it is because I don't diagnose, treat, or prevent or cure anything. But I'll tell you what happened to this woman. She had a massive amount of this stuff come out in just one colonic. And the next day she came in for her follow-up and she's talking. She wasn't talking before. She wasn't making eye contact. She couldn't move. So my MS patients are moving better when things are like this are coming out. So she was actually having a conversation and her husband, he goes, we couldn't shut her up. Hold on, it's here somewhere. Oh, it was just too awesome. It blew my mind. All I know is this really has to be checked into, really looked into. Others just me saying, hey, look how sick I was. Now I eat whatever I want, and that's why I gained so much weight. And I'll always enjoy food. And I do talk about the vagus nerve in this thing, but we don't have to go through it. It really is. I can put a link to this, whoever wants to see this.
If you
I
put
do
the
want to
link in the
work with
chat, that
you,
would be great.
doctors. I would love to go to your office and do a presentation. I offer you guys lunch because my goal in life is to I really want you to understand what it is that we do here and what we're seeing and what's happening here. It's actually amazing, and I want us to work together. But there's this woman. So the husband comes in and says, we could not shut her up. She was just like, we couldn't shut her up. So her whole family talked to her because as a stroke victim, she couldn't get words out. She couldn't write them down. They're all jumbled up and something happens. And then all of a sudden everything is clear. And it might be short-lived. You know, she's not getting a colonic every day. I don't know how much of this stuff is in there, but she improved so dramatically just by releasing whatever that stuff was inside of her.
That's amazing. Yeah. Gigi, can you share your screen so we
Sure.
can just go back to the big, yeah, perfect. Thank you so much. I'm glad you guys also mentioned, just serotonin and those things, because my next question was, can healing the gut microbiome impact anxiety and depression? So that was another thing that I think was surprising to me. Like, first, just learning the connection between your gut health and cognitive function, and then the fact that there's a direct connection between a person's anxiety level or depression level. I mean, that was really, like, new to me, that wow, just something as simple as, what you eat, how you digest it, whether or not you take, the nutrients from that or not, or the negative things, things that might not be that great for you that you might be eating, can play a role in, your everyday life, not just stress, but just your anxiety level, your mood, whether you're depressed or not. I think there's more information coming out now, but that's something that people need to know more about, that there is that direct connection. And by healing the gut, we can alleviate those types of symptoms.
Look at kids with ADD. If you cut
Yep.
sugar out of their diet, their energy levels like balance out. They're not kind of going crazy, right? I mean, there's so many different things to be able to visualize just by making those changes. And kids are kind of like a blank slate, and so they're I find a little bit easier to work with from the realm of GI things. As adults, we have more years, so we have a little bit more junk to take out, but it doesn't mean that it's impossible. It just means you have to give your provider some time to kind of rework it backwards, because things just kind of, you find compensatory mechanisms. As was mentioned before, the body is so intelligent that it needs to prioritize your survival, and if it does it in a way that maybe seems undesirable to you, like from a symptom standpoint, just means that we need to kind of work everything so those things kind of undo themselves. But everything happens as like, whether it's a symptom, a feeling, whatever it may be, is all your body telling you. And the best talker is your digestive tract, because you can feel when you're hungry or not. You feel stomach pains. All those things are loud and clear. And I think it's just a matter of listening to them.
Right. I tell a lot of people who struggle with, oh my gosh, I'm working with a naturopath, but it's taking forever. I'm like, listen, you didn't create that disease overnight or in a week or probably a month, right? So it's like the cumulative effect of all of those months and years of, having, whether it's the way you ate or the lifestyle or the stress or whatever, the things that led up to that, it's like you said, Lindsay, it's the unraveling of that, right? So it might take months, it might even take years to fix something, but you're doing it. Isn't that so much better than just putting a band-aid on it by going and, taking a prescription medication or even over the counter, whatever it might be? It's, to me, to be able to be working on your health from a natural perspective, it doesn't matter how long it takes, in my opinion.
My mentor, the late Dr. Senseneg, used to say it would take a minimum of 1 month of healing for every year that you've been sick. And if we can, at this point, argue that we're pretty much popping out that way, like that there's some level of the body compensating for its environment at birth, it really can take quite a while to see a full healing occur. But that said, I would say not to be discouraged because most people will see some sort of improvement much sooner than, months and months and months. I mean, I'm not asking my patients to wait that long to feel anything,
Right.
but it does take work. I mean, nobody claimed that naturopathic medicine or natural healing is easy. It does take some work and commitment and some effort, but, we try not to make it impossible and encourage you along the way.
I remember him saying that. In fact, when I just said what I said, that he was in my head. I'm like, I know that there was somebody that said that to me a long time ago. Like there was this, he had this calculation, like a month for a year or whatever, but I couldn't remember. So that's so funny. He was a great guy.
I took classes with him as well, and amazing guy, was amazing. So yeah, so it depends also on what part of the organ we're healing and then how long everything regenerates. So we know the intestinal lining can regenerate every 3 days. So you just put your body in that environment, no cheating, right? For that amount of time, and it can regenerate. So for my story, where I had tears, now a septic, I had 3 tears in the colon in 2006, why they wanted to remove my colon and have me go into colostomy bag for the rest of my life. And I walked out of that hospital. I said, no, I was 29 years old. I said, no. And I was married and I had a 2-year-old. I just got married. I left that hospital against, they're like, you're going to kill yourself. And I'm like, so be it. I'm going to die on my terms. But I read a book, Gallon of Water, apple cider vinegar, shut off the fire, heal. Then I got my naturopath and she put me on some glutamine and slippery elm stuff and other stuff. And we fixed my deficiencies. I was deficient in like everything. I was anemic. I was a hot mess. And I went and then I felt great. And I was like, okay, the book says 15 colonics in 30 days. That's the next step. And she's like, ho, 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 you need an intact colon, Missy. You need another colonoscopy. I'm like, go back to those guys. I'm like, oh no. And so I go back, had another colonoscopy about 12 weeks later. It was 12 weeks from you're dying to another one where the doctor said, it's like you were never sick. And it completely healed. So I just think the way I did it and how I did it in the order I did it, and I did not cheat. I did it as my life depended on it. I didn't eat sweets. I didn't do this. I mean, my life really did depend on it, but it was, I did not cheat. I did not eat anything I wasn't supposed to eat. Like I was a good girl, at least for 3 months, right? And then I just, found out that, she didn't care why or what I did. I told her, I got to tell you what I did. And the only awesome people there that day was the nurses that surrounded my bed, because these women knew exactly who I was. I lived there for about 2 years in that hospital. I got to know the nurses really well. They're the only ones that wanted to know my story. They're the only ones who wanted to know everything I did. And that was my wake-up call to get out of marketing and real estate and become a practitioner. So then I went back to, then I've been on a mission. I knew there was something very wrong here.
Yeah, that's an awesome story. I have a question in the chat, so I want to get to this before I just have a couple more of my own. But the question is, do you have a quick reference guide? Do any of you have a quick reference guide of general recommendations for promoting gut health without pharmacology?
Well, I mentioned a few things. I I think for everyone, I think we need enzymes. We need something that keeps our stomach acids acidic. If we keep taking something to alkaline our stomach, you're going to have an acidic blood. So an acidic blood, that's where disease starts, right? I think even like we can all agree on that. A medical doctor has to agree on that when the balance is off, homeostasis is off. So to get your body in balance, you have to keep your stomach acidic.
Mhm.
And if that's acidic, so if you have heartburn, what it's going up, it's looking for something to get acidic and bring it back down. It's trying to balance itself out. That's all heartburn is. That's all GERD is. So keep your stomach acidic, either through enzymes. If they're really severe and they're not breaking down food and they're seeing a salad in their toilet, I think they are going to have to get some naturopath. I am strongly pushing all my clients to see naturopath because I can't do it alone. I am like, I do the dirty work. I see what's in there. I want to report. I report to our naturopath. Katie, I think you've worked with Dr. Sparks. You guys both work together over there, and she's amazing. And I have other naturopaths. I have Dr. Heather Veronese, and I just like we push them. I push them to other guys in here. If you go on my website, I have a bunch of naturopaths and other practitioners on there that, you know, combining modality is so important. When it gets to enzymes.
Let me ask Dr. Katie and Dr. Lindsay what their protocols are.
I mean, in terms, the question is without pharmacology. So I'm not sure if that means without supplementation or
I'm going to say without like prescription medication.
Without prescriptions is what I'm thinking or interpreting that as. So I think that nutrition or food is probably the most important starting place. So eliminating processed foods, toxic foods, you know, things that are going to disturb the microbiome and cause inflammation, and also eating and consuming the healthy things. So, you know, if at the very least you increase, you know, organic fruits and vegetables, if you add a probiotic food to your diet, so not just a capsule, but the actual foods like sauerkraut, kimchi, but make sure that when you look at probiotics, they say live cultures, because something that's pickled does not necessarily have live cultures in it. So always looking at, you know, what you're consuming as a starting point. And then there's all kinds of supplementation that can help depending on your symptoms. You know, I do prefer to use things that stimulate the enzymes and the acids versus just giving them as a supplement, but sometimes that's necessary. But all kinds of things will help with actually healing the gut, like, you know, different supplements that we use, anything from L-glutamine to, you know, even I've been recently doing some research on glycine, and the combination effect that has on brain health, ADHD, and the gut. So that piece of it is individualized. So I don't have like a quick reference, but I would say definitely looking at the foundations of health, which are nutrition, sleep, stress, exercise, and then looking at supplements as well.
That's awesome.
And then I like to take kind of an approach that's similar to like what old naturopath philosophies and principles would be, like the 4R protocol, but I kind of took it down and it's like weed, seed, and seal. So you want to basically kind of eliminate common allergens potentially for a short period of time, because when you go through your life on a day-to-day basis, how you experience it is normal to you. And so there might be something that's irritating and you don't know that until you remove it and potentially bring it back in, or you know, you notice a change just having removed it. And then if you give it some time, bringing it back in might be okay. But the idea is that poor digestive health is a culmination of inflammation, and that is kind of what you want to calm down. And you wouldn't put fuel on a fire, so you wouldn't take potentially, you know, inflammatory driving foods or products during that time. So you'd want to remove things that are less commonly antagonizing, if you will. And so an easy way to start is from there. But it's all dependent upon how either quickly or how determined somebody is, because you could do a stool analysis if you wanted to find what your individual needs are. But on the flip side, doing something like removing those potential inflammatory triggers, then optimizing stress so that you can actually digest your food, and then, bringing in more variety of those things. Whereas you can do things like take bitters, but you can also do bitter greens to help stimulate digestions like arugula, dandelion, those types of things. And then start to give yourself some really good cultures of probiotics, foods, functional foods, identifying enriched in polyphenols. That's a big one. A lot of people do it, like to do cranberries, tart cherries, pomegranates. Eating in season for me is a big one, because I think that is largely an inflammatory trigger. We can now get avocados 12 months out of the year. You never used to be able to do that. So we're not rotating our food like we used to be. So if I were to do food sensitivity testing, I commonly found that the foods people were being triggered by were actually foods that they were most frequently eating. So that could just speak to the lack of rotation that we're experiencing. So buy 1 to 2 different vegetables every week, and go on Pinterest and kind of search a way to cook it. Everyone gets that kohlrabi in their food share. No one knows what to do with it. So just
So
try
true.
so get a little creative. I go through ebbs and flows too, and it might spark a newfound interest in cooking.
Yeah.
And then just kind of reevaluate yourself after 3 to 6 months, see how you're feeling, and kind of target what your needs are from there.
And actually, this next question is kind of like piggybacking on that. Is the Yucca, I'm assuming it's pronounced Yucca, Yuka, Yucca app a reliable tool for shopping for clean foods that can support gut health? I'm actually not familiar with that app. Have you guys heard of that?
Yes.
I've heard of it. I'm not super familiar with it, but
I have not used it, but I have gotten mixed reviews from patients who have done independent research. So there are some people who say, yes, it is pretty reliable, but then others have found it not to be. So I think it's just one of those things where when you kind of take I don't want to call it corner cutting because we're all busy, but sometimes we have to do a little bit of our own deep diving to really understand. Some of those apps, they're paid and bought by certain people too, that might prioritize certain items over others.
Yeah. Anything that you guys can suggest, like while we're on that topic, like any apps that you use that you do like, or resources that you would suggest, or any cutting edge therapies or new things that you're seeing in relation to gut health?
I like ewg.org, the Environmental Working Group. More so, I think they have an app, but they are the ones that publish the Clean 15 and Dirty Dozen every year, which is the most toxic, least toxic produce. But they also have all kinds of information about things in our environment and help you as a consumer pick things that are less toxic. So that is probably the one thing I recommend the most to my patients as a resource. There isn't a particular app specifically for gut healing. There are some other apps that I recommend on occasion for different things. But so that's really, and then as far as things that are cutting edge, I think some of it is really more that the research is catching up to some of the things we've known for a long time. But there's definitely a little bit more coming out about specific strains of bacteria for specific issues that people are having. And as Dr. Marr touched on, the fecal transplant research is interesting, but it also seems to be more and more impractical in terms of the possibility of that being something that would be a more widespread treatment because of the need for a clean donor, because clean donors really just either don't exist or they're children. And so, we can't be literally like tapping the stool of our finding children to like give stool samples all the time. So I think that is sort of interesting to see the research coming out more, that it's not probably going to be something in the near future anyway that we're going to see as a widespread tool. Although it has incredible benefits, it's just really impractical. So
I think some peptides have been really making waves too when it comes to gut health, and specifically one is BPC 157. that is, there's a whole peptide thing with like the injectables, but I'm talking from an oral standpoint, which is now more available from a supplement capability. And we know that essentially a peptide is a small protein. It just doesn't have as many amino acids in it. And BPC specifically is sequenced from bile acids in the body. So we're taking a similar compound that we naturally make, and they have found it to have really great gut healing benefits when taken orally. Doing it from an injectable standpoint is a little bit different.
And of course, I'm going to say colon hydrotherapy. I have the open system, and it's gravity fed, it's clean water, it's non-invasive, it's a small little tiny tube. We see a lot of things coming out. You're stimulating vagus nerve, you're getting oxygen therapy. You could do a lymphatic drainage while you're doing it, at least on the open system, you can. The other systems can do all of that. So definitely it increases hydration. It does decrease electrolytes, which we do replenish them with before they leave. We do talk about stuff. So when they do come here, our doctor and I, we put something together, a little template, just to get them started. We do educate them on a naturopath. Who is a naturopath? I'm on Groupon. So I get a lot of people here that never heard of a naturopath. I even got somebody here that didn't even know what an acupuncture was, which I was shocked about that one. So we're getting newbies all the time, and that is my goal, is to introduce people to holistic healthcare and all the different modalities that are out there for people.
Awesome. And then Diane is asking, not me, another Diane, looking for a new probiotic. Any suggestions?
I've been recommending designs from Probiophage. I believe that's how you pronounce it. It's a prebiotic and a probiotic. It's less gas producing. A lot of people have been testing positive for SIBO. So almost, I want to say about 80% of the clients that I get, and I do get a lot of clients here, and 80% are testing positive for SIBO. So I used to have a regular probiotic in there by Clear Labs, but now I just switched it to this little more potent that addresses in small intestines and large intestine together.
Mhm.
I think it depends on what the goals are.
Yeah, I know. It's kind of hard to just give a blanket.
It is,
one,
but you
right?
have to tell them. You got to teach them, like, hey, this is
Yeah.
what it is. You think this is you, or go get a naturopath and go get tested. You got to give them information. You can't just like, here's a flyer and throw it all over the place and hope they can help themselves. But they really do need a naturopath. I don't think anyone can do it without the testing that you guys can provide.
No, I agree. I don't like to make broad strokes recommendations for probiotics because some of them are histamine forming and they can actually exacerbate someone's symptoms. And then others could be, some are spore forming, some is, and also brands are super, that's super important too. Does it have to be refrigerated? Does it not? There's just a lot of nuance to it. And so that's just something I usually cover in practice. So if I do get this question and it's outside of practice, this is usually my answer.
I would 100% agree that I wouldn't give a brand right now in this environment, but I will say there is no probiotic that anywhere that contains as many diversity of strains as actually fermented foods. So that I feel like I am more comfortable recommending to pretty much everyone, is that you include fermented foods in your diet that have live cultures in them. So that would be my good for everybody kind of recommendation.
Which I think people should, that to me, that I'd rather do that than try to figure out a supplement. I mean, honestly, we should be looking at whole food first anyway.
Yeah, it's hard to just throw something at it. Like, if there is something in that template that we have that they can't be on, I'm definitely going to take it out. Not everybody can be on bitters, but the people who qualify for a colonic can usually take all this other stuff. So there's a lot of contraindications to colonics. It's not for everyone.
Right, right. And then I know we're over, Judge. I'm just going to ask one more question. If you guys have any quick advice on this, water purification. Any thoughts on a good option for someone to use for home tap water? And is reverse osmosis the best?
I think regardless of what water filtration system you're using, knowing that there's it's non-discriminatory, so it's removing good and bad. So you need to make sure that you replace your filtered water with minerals.
I use a reverse osmosis with added remineralization.
Yeah, that reverse osmosis in particular is going to strip out pretty much the most of any water filtration system, meaning that what remains can be very acidic because it takes out all of the minerals that you need. So agree to add them back in. I do, as far as, because obviously there's budget constraints. So on the opposite end of extreme, if you're going to get like a countertop or a pitcher system, I am okay with the zero water products. I think they're decent as compared to like a Brita. But anything, you know, that you can get that's going to filter your home system is going to be ideal.
Awesome. All right. Well, I want to thank you guys, Gigi, Dr. Katie, Dr. Lindsay. This has been really awesome. Great, great information. And like I said, we'll get the recording edited and we should have it emailed out to you guys probably middle of next week. And thanks everybody for joining on the call as well. And hope you guys all have a great rest of your day.
Yeah.